Hello everyone, my name is Alwina Ghazi and I'm from Khan University, Karachi, Pakistan. Today I'll be presenting my master's thesis project, which is on use of social media and its effects on mental well-being of adolescents in Chitral, Pakistan. So the background of the study is social media has become an important part of adolescents' daily lives. It influences how young people communicate, learn, build friendships, and form their identities. However, its increasing use has also raised concern regarding emotional health, social relationships, and mental well-being. In remote regions like Chitral, Pakistan, which is my hometown too, internet access among adolescents is growing rapidly. At the same time, mental health problems and youth suicides are becoming important public health concerns. Despite this, there is very little research which explored the social media effects, how social media affects adolescents living in rural and mountainous communities. Therefore, this study aims to understand adolescents and teachers' perception regarding social media use and its effects on mental well-being. So the method of this study is this. This is a descriptive exploratory qualitative study. It was conducted in 4 high schools in Chitral. Purposive sampling was used, which included like adolescents from grade 8 to 10 from all those 4 schools along with the teachers of those classes. So the data collections included focus group discussions with students and in-depth interviews with teachers. In total, we conducted 8 focus group discussions and 12 IDIs with 58 number of students and 12 teachers participated. For the data analysis, we used Brown's and Clark's thematic analysis framework, combining both deductive and inductive approaches to identify, measure themes, and emerging insights. So the results of this study shows that there were 3 major themes were identified. The first theme is adolescents' access to social media. The first theme highlighted adolescents' widespread access to social media platforms like TikTok, Facebook, WhatsApp, YouTube, and others. Many participants reported spending several hours on daily on social media using their mobile phones or their families' mobile phones. One student shared that I use social media accounts like Facebook, TikTok, Instagram, and others. I use it daily for 3 to 4 hours. So this shows that social media has become deeply integrated into adolescents' everyday routine. So the theme two is purpose of use and adolescents' life. The second theme explored why adolescents use social media. Participants described social media as a multi-purpose tool used for entertainment, making friends, to communicate with others, and educational support. Some students explained that they use YouTube and online resources to better understand difficult classroom topics. For example, one of the students said that if we don't understand any topic in class, we can go home and watch it on YouTube. We can use it for education. So this demonstrates that social media can also serve as a valuable educational resource when used positively. However, participants also mentioned the addictive patterns of use and excessive screen time. The main theme three is shaping minds, social media, and mental well-being. So this theme focused on psychological and emotional impact of social media. Participants reported feelings of stress, sadness, low self-esteem, and social comparison linked to prolonged exposure to online content. Several teachers and students described that how adolescents compare their lifestyles, appearance, and financial status with what they see online. One teacher noted that these comparisons can negatively affect mental health, especially among adolescents from low income families. Participants also discussed eh, about symptoms like headaches, feeling of isolation, and emotional distress associated with excessive mobile phone use. These findings highlight the complex relationship between social media and adolescents' mental well being. So the conclusion of this findings is that in our study found that social media it is both a platform for empowerment and learning and a source of vulnerability among adolescents in the region. While it promotes education, communication, and self expressions, it can also contribute to isolation, unhealthy comparison, and emotional distress. Addressing these challenges require collaborative efforts from different stakeholders, including parents, teachers, community members, policymakers, and mental health professionals. Promoting healthy digital habits and mental health awareness among adolescents is essential for supporting their overall well-being. So, thank you so much for your time and attention. I would be happy to answer any question.